My daughter was born 2 years ago. I thought I was taking home a healthy, happy baby girl. But looking back, even her baby pictures from the hospital showed that her feet were clearly blue. She was discharged as if everything was okay. We went to every single weekly checkup. I kept noticing that her hands and feet were cold and that her skin was mottled. Then at 2 weeks, she started throwing up a lot, and she was diagnosed with gastroesophageal reflux disease. Since I was breastfeeding her, I was advised to cut out all dairy, which I did. But she still didn't act right. I remember holding her and thinking that her heart was racing. But I just thought that infants' hearts beat faster, and I knew I was taking her to the doctor. At her 3-week checkup, the pediatrician said, "I don't like her color." And I said, "I don't like the way she's acting." Her little chest would cave in sometimes when she was breathing, and there were nights that she would just stay awake and cry and cry and cry. Her pediatrician did some blood work, and he said something was off with her kidneys, but nothing else was determined. If she had been my first child, I might not have known that this behavior just wasn't right. So I feel fortunate that she was my second child so that I knew what was normal and what wasn't. I kept taking her back to the doctor, and while I didn't feel that things were quite right, I also trusted the doctor, and I didn't want him to think that I was crazy. Looking back, it's hard to see these pictures. It's so hard for me because I realize that I'm looking at pictures of a dying baby, and I just didn't realize it. One Thursday, I remember that she just became lethargic. She had a blank stare, and her eyes were glazed over. I realize now that it was a help me stare. Phelan was spending the night with her grandma, and she realized something was wrong because she stayed up all night crying, and it seemed like it was hard for her to breathe. So that Saturday morning, her grandmother took her to the clinic, and since it was a Saturday, her regular pediatrician wasn't there, and a different doctor saw her. He heard a murmur. He saw that she was retracting when she was breathing, so he ordered a chest x-ray at the emergency room in Bartlesville. Immediately, they could see that blood was backing up into her lungs, so they sent us to St. Francis immediately. That night, she had an echocardiogram. My cousin works at St. Francis, and she came into Phelan's room and stood at the foot of her bed and cried. She called my mother, and my mother didn't know I could hear, but all my cousin kept saying was heart failure, heart failure. Phelan was diagnosed with Triatriatum. It occurs in less than 0.1% of all heart defects. If babies aren't diagnosed and treated within 2 weeks, it kills 75% of them. Triatriatum is so deadly because usually by the time a doctor is able to detect a murmur, it's usually too late. The pediatric heart surgeon at St. Francis happened to be out of town at a medical conference, so we had to be flown to Dallas. I'm forever grateful to her cardiologist, Dr. Maginero, and the staff at St. Francis for promptly treating my daughter after she was diagnosed and getting her help immediately. All this took place in the middle of the February 2011 blizzard. This is a very, very rare condition in which there is a membrane that grows in the left atrium that obstructs blood flow. So in Dallas, she was on the heart bypass machine for 63 minutes, and her heart was stopped for 36 minutes. The surgeon was able to do open heart surgery and remove the membrane. Right now, her repair is working and it's holding. Dr. Maginero has been with us ever since diagnosis, and we are so happy to have her available to help Phelan. I remember getting home from the hospital and thinking, there must be something I can do so that other babies don't go through this. so that no family takes home a baby not realizing there is a serious heart defect. I am so glad to say that I am now a legislative advocate for the American Heart Association. This legislative session, my friend Representative Kirby of Broken Arrow will be introducing legislation to require pulse oximetry testing for all newborns. This is the test with a little clip on a finger or toe to determine the oxygen level in a person's blood. In the state of Oklahoma, we test a newborn's hearing, but not their oxygen. This simple test would let doctors know if there might be a heart problem, and it could help children, like Phelan, get the help they need much sooner. I hope that you will write a letter to your state senators and representatives asking them to support the American Heart Association's bill to require pulse oximetry. It could save babies like mine. And now I would like for you to meet my daughter, Phelan. I'd like to ask some friends in the audience to join me on stage. I see that everyone has their lights on your tables turned on. Would you please turn them off at this time? And we're going to dim the lights. And when one of these people says something that applies to you, please stand and turn on your light. We want to see how many lights are on and how many people are standing by the end. If you have ever known a baby born with a heart defect, please turn on your light.
If you've ever known a person who had a heart attack, please stand and turn on your light.
If you have ever used CPR to save a life, or if you are trained in CPR and ready to save a life in an emergency, please stand and turn on your light.
If you ever known a child with any children with hypoplasmic right ventricular syndrome, please turn on your light. Even when they're born with a heart, half a heart, they have a heart as big as ours.
If you've ever had to depend on a great heart doctor, turn on your light.
If you've ever depended on a great heart nurse, please stand and turn on your light.
If you've ever known a person who's had a stroke, please stand and turn on your lights.
If you've ever lost a friend, please stand and turn on your light.
If you knew Andrea, please stand and turn on your light.
Thank you so much. Take your seats, please. When you look around, it's really obvious how many of us are touched by heart disease and stroke and all of the other ailments that the American Heart Association is fighting against. We have an opportunity in just a moment for you to pledge from the heart, knowing what you know, seeing all of the lights, pledge what you would like to give toward the mission of the American Heart Association, and however that looks, we'll have Joseph help us. one moment for This Little Light of Mine.
This little light of mine, I'm gonna let it shine. Sing it. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine, let it shine, let it shine. Yeah.
Thank you so much. And at this moment, you may all turn your lights back up.